The AHIMA RHIT certification is one of the most respected credentials in health information management because it validates your ability to manage healthcare data accurately, securely, and efficiently. Many candidates focus heavily on memorizing definitions, but the exam often tests whether you can apply those concepts in real-world situations. For example, you may know what a health record contains, but can you determine whether documentation meets compliance standards or identify missing elements in a patient chart? That practical decision-making ability is what employers value most. As healthcare organizations continue expanding electronic health records and digital systems, RHIT professionals play an increasingly important role in maintaining data quality, protecting patient information, and supporting better healthcare outcomes. One area that often surprises candidates is the importance of data standards and information governance. Healthcare organizations rely on standardized vocabularies and consistent documentation so information can move accurately between different systems. If one department records information differently from another, patient safety and reporting accuracy can suffer. The exam may present scenarios where you must identify data quality problems or recommend governance solutions. A useful strategy is to focus on why standards exist rather than simply memorizing terms. By understanding the purpose behind policies and procedures, questions become easier to analyze. If you're enjoying the lesson so far, please like this video, subscribe to the channel, and enable notifications so you never miss future exam preparation content. Another skill tested throughout the RHIT exam is the ability to interpret information rather than simply recall facts. Candidates often miss questions because they rush through scenarios without identifying the key issue first. For example, a question may appear to focus on technology, when the real issue involves compliance or documentation integrity. Learning to identify keywords and eliminate incorrect options can significantly improve your score. Many successful candidates practice with realistic scenarios repeatedly until the decision-making process becomes natural. To get the complete practice test package and the full offline mobile and PC app, please check the links in the video description below. Consistent practice helps reinforce concepts and exposes you to the different ways exam questions can be structured. When studying health record management and privacy regulations, remember that accuracy and security work together. A complete patient record is valuable only if authorized individuals can access it appropriately. HIPAA principles, role-based access controls, and disclosure requirements frequently appear in exam questions. Imagine a staff member accessing records unrelated to their job responsibilities, even if no information is shared externally. That access may still violate privacy policies. Candidates should also understand business associate agreements, patient access rights, and breach response procedures. The exam often tests whether you can distinguish between proper access, improper disclosure, and situations requiring corrective action. Understanding these distinctions helps both on the exam and in professional practice. Healthcare statistics and revenue cycle concepts are also highly important because they connect clinical services with organizational performance. Candidates should recognize metrics such as occupancy rates, mortality rates, and productivity indicators. Questions may ask you to identify trends or interpret performance reports. On the financial side, understanding how patient registration, coding, billing, reimbursement, and collections fit together can help you solve complex scenarios. Many candidates make mistakes by studying reimbursement systems separately instead of viewing them as part of a complete process. whether discussing DRGs for inpatient services or APCs for outpatient care. The exam frequently evaluates your understanding of how accurate documentation and coding directly affect reimbursement and organizational financial health. Clinical coding and documentation integrity represent some of the most detailed portions of the RHIT examination. A common exam trap involves selecting a code based on assumptions rather than documented evidence. Coders must assign codes only from information supported by provider documentation. You should also recognize terms such as UP coding, unbundling, compliance audits, and physician queries. For example, if documentation is unclear, the correct response is often to initiate an appropriate physician query rather than making assumptions. Understanding official coding guidelines, documentation requirements, and ethical coding practices not only improves exam performance, but also helps protect healthcare organizations from compliance risks and inaccurate reimbursement claims. Leadership and systems management skills are increasingly important in modern healthcare environments. RHIT professionals are often involved in workflow improvements, technology implementations, and quality initiatives. One concept worth understanding is root cause analysis, a structured method used to identify why an error occurred rather than simply addressing its symptoms. For example, if patient records are repeatedly delayed, the true problem may involve workflow design rather than employee performance. Candidates should also understand project planning, change management, decision support systems, and quality improvement methodologies. The exam may present workplace scenarios where the best answer focuses on long-term process improvement rather than a temporary fix. Today you learned how data governance supports information accuracy, why privacy and security regulations are essential, how healthcare statistics and revenue cycle concepts influence organizational performance, why coding integrity matters, and how leadership principles improve healthcare operations. These topics represent only a small sample of the knowledge areas covered on the RHIT examination, and each area contains many additional concepts, scenarios, and practice questions that candidates should master. Consistent study, realistic practice, and a strong understanding of real-world applications can significantly increase your confidence on exam day. If you found this video helpful, please like, subscribe, and share it with others preparing for this certification. To access the complete practice tests, detailed explanations, and the full offline mobile and PC app, check the links in the description below.